Nigeria's COVID-19 tally rises to 11,500 as NCDC announces 350 new cases. Budget claims 51 billion naira of federal government's money has ended up in personal account, calls for investigation. In international news, U.S. businesses face looting woes after more than a week of chaos over George Floyd's murder. And in sport, Premier League agreed to 5 substitutions rule change.
This is ANN News.
I am Olajumoke Olatuji. Despite Nigeria's determination to flatten the COVID-19 curve, new cases have been mounting daily. 350 new infections on Thursday alone. The Nigeria Center for Disease Control says that figure has raised the tally to 11,516. NCDC says 3,500 of those have been discharged, while 323 have died. The new cases were shared among 19 states. Lagos continues to host a brunt of the cases, registering 102 infections on Thursday. The Presidential Task Force on COVID-19, PTF, says during its Thursday briefing, the World Health Organization has resumed its use of hydroxychloroquine in the fight against COVID-19. This was confirmed by the chairman of the committee and secretary to the government of the Federation, Boss Mustafa, during the PTF's briefing. The PTF chairman warned Nigerians to desist from self-medicating and gravitating toward the drug. The federal government has acknowledged that the COVID-19 pandemic is gravely affecting the country's revenues. Minister of Information and Culture, Lai Mohammed, told State House correspondents after Thursday's Federal Executive Council meeting that the impact was serious. Mohammed said Nigeria suffered huge losses as crude oil prices plummeted to $18 per barrel. He also pointed to the weeks-long lockdowns in Lagos, Ogun and Abuja and border closures as contributing factors. The information minister said the country hopes crude prices would rise to at least $30 per barrel, especially now that COVID-19 has attacked every source of the nation's revenue. The Central Bank of Nigeria has set out some measures to tackle the economic impact of the virus. It has set up a 50 billion naira fund to support the economy. The Central Bank has also cut interest rates and placed a moratorium on principal repayments for CBN intervention facilities. As correspondent Kelechi Mekalam reports, these measures are expected to help small businesses recover from the impact of COVID-19.
Emmanuel Kyungnom is excited to be back in business after being shut down for nearly 3 months. His paint business has seen one of its worst downturns in 7 years, a loss of over $1,500 caused by the effect of a coronavirus outbreak. And it may take a while before it picks up again.
Since this pandemic started, the business has been down, has been low. First and foremost, there is no money. We have been experiencing low patronage.
Nigeria's central bank has made several interventions to ease monetary distress on businesses, from accelerating a $50 billion loan facility for small businesses. Now the latest move is the reduction of its monetary policy rate.
I think the low interest rates as CBN have announced, I think will help, especially like person like we, in order to put in more money into our business, to push the business to a greater height.
Although the monetary policy rate reduction will make lending cheaper and stimulate the economy, it might still not be enough to bring a meaningful recovery.
Well, it might not have immediate direct impact. I think authorities, particularly Monetary Policy Committee and Central Bank of Nigeria, we need to do more in terms of accelerating facility giving to small businesses beyond the 50 billion naira. I think by now what Nigerian authorities should consider is an amount that is not less than 200 billion naira, approximately $500 million is what they need to impact the economy. Yes, it's significant, but the level of significance will not be much. It will save us to some extent, but we need to combine the reduction by 100 basis points, talking about 13.5 to 12.5. We need to combine that with fiscal policy, which will come, of course, from authorities other than Monetary Authority, with Monetary Policy Committee and Central Bank of Nigeria.
Nigeria's economy was making a slow recovery from the 2016 recession before the coronavirus outbreak. Now, inflationary pressure, a halt on international trade, and a decline in manufacturing is weakening the already fragile economy. Experts say increased demand and government spending can stimulate the economy and put it back on track.
Kogi State is still reeling from Thursday's deadly bank robbery in Isalu, where a police station and the community were attacked during the operation. At least 23 persons were reported killed. 7 police officers were also murdered at the Isalu police station. Kogi State's Governor Yahya Bello has called on security agencies in the state to pursue the criminals and bring them to justice. He described the act as unacceptable, dastardly, and cowardly. Joining in the call to apprehend the perpetrators was Senator Dino Melaye, who expressed sadness and said the robbery attack and loss of lives were sad and unfortunate. Melaye called on the governor to show the resolve to protect Kogi people in every part of the state. In December last year, President Muhammadu Buhari launched the Open Treasury Portal in a bid to increase transparency in government spending. It appears the portal is working well. Budgets, a civic organization that monitors public spending, says it has detected that 51 billion naira of government's money has found its way into personal bank accounts. It has urged the president to investigate. In a report on Thursday, Budget said it has discovered more than 5,000 payments without descriptions, totaling nearly 300 billion naira. The report also said nearly 3,000 payments records of 51 billion naira were made into personal accounts with vague descriptions. The All Progressives Congress APC had said the launch of the portal pointed to Buhari's determination to root out corruption in the public sector and stop the looting of the nation's treasury. Coming up, African news. COVID-19 shifts attention from treatment of other diseases in Africa. And later, international news. U.S. businesses face looting wars after more than a week of chaos over George Floyd's murder.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, African News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. COVID-19 is said to have severely disrupted prevention and treatment services for non-communicable diseases in Africa. Many patients who need treatment for diseases like cancer, cardiovascular disease and diabetes are said to have been unable to receive the health services and medicines they need. Correspondent Daniel Arap Moy reports that a deadly interplay between the COVID-19 pandemic and non-communicable diseases has been brought to the fore.
The COVID-19 pandemic and non-communicable diseases have brought about a deadly interplay. Services have become increasingly disrupted as African countries move from sporadic cases to community transmission of the coronavirus.
Because of COVID-19, there is a bigger impact on all the other diseases. We mainly call them as non-communicable diseases especially. The highest mortality rate in today's world is because of non-communicable diseases. Even in Africa, by 2021, that is next year, it is being said that the biggest cause for death would be not the infections but the non-communicable diseases like diabetes, hypertension and other diseases like cancer and respiratory illness.
According to the latest survey released by WHO, the impact is global, but low-income countries are the most affected. Many African countries are reportedly experiencing disruption in services for hypertension treatment, with 49% for treatment for diabetes and diabetes-related complications, 42% for cancer treatment, and 31% for cardiovascular emergencies.
Because of COVID-19, most of the hospitals are taking COVID cases, and then it is a bigger impact on the patient who is already immunocompromised with diabetes, hypertension or any kind of cancer for that matter. We are not able to admit them because of having COVID-19 cases in the hospital because they are more vulnerable to get cases of corona.
Doctors say it will take some time before countries know the full extent of the impact of disruptions to health care during the COVID-19 pandemic on people with non-communicable diseases. What remains clear is that not only are people with non-communicable diseases more vulnerable to becoming seriously ill with the virus, but many are unable to access the treatment they need to manage their illnesses.
Food aid organizations are saying the already dire food security situation in South Sudan could worsen with the adverse economic impact of COVID-19, including a slowdown in the importation of basic commodities. As Patrick Hoyert reports, markets are under significant stress as prices of food items have risen sharply.
The effects of COVID-19 are worsening the food security situation in South Sudan. Non-essential businesses have been closed since March and food prices are rising because very little is being imported. Truck drivers importing food are tested before being allowed into the country. The process takes days. Coupled with low oil prices, that has left the government running out of money. Civil servants have gone months without salaries. Many South Sudanese people are now unable to afford basic commodities. Some businesses are closing down.
Business is down because people are fearing, no movement. Yeah, even for us here, we are down. Look at it, nobody. From the morning we are sitting, no business.
The humanitarian situation in South Sudan was dire even before the emergence of the coronavirus. Flooding in most parts of the country in December last year washed away homes, crops and livestock. Now, most parts of the country are flooding again, and years of civil war have denied many farmers the opportunity to cultivate.
We have to keep supply lines moving. We have to keep humanitarian assistance taking place in order to ensure that countries like South Sudan can get through COVID-19 without making all of the challenges it already faces that much worse.
The WFP says it has given more than 2.6 million people 3 months of food assistance as part of its COVID-19 response. South Sudan's government estimates that 65% of the population lives below the poverty line. Impact of COVID-19 on the economy is making the already dire food security situation even worse. Many here who are already dependent on aid could need help for even longer.
Algeria is making preparations for a gradual resumption of work once a decision is made to ease the coronavirus lockdown in the country. Part of that preparation is the launching of a reconfiguration operation of the tram to ensure the cabins comply with social distancing rules. The tramway company Setram in Oran, Western Algeria, says the reconfiguration will reduce the number of seats in each cabin from 44 to 22. The number of standing passengers will also be reduced by 75%. The company says it will mobilize many employees to assist passengers inside and outside the tram. It has called on passengers to respect the preventive measures. When we return, international news. U.S. businesses face looting wars after more than a week of chaos over George Floyd's murder. And later, sports. Premier League agreed to 5 substitutions rule change.
You are watching ANN.
Welcome back. This is ANN News. Independent retailers in the U.S. are now not only worried about the economic setback the coronavirus pandemic has caused them, but also the losses accrued when vandals targeted them and looters struck during large demonstrations over the Minneapolis police killing of George Floyd.
After shutting their doors for months during the pandemic, some businesses in Los Angeles were just getting ready to reopen. But the recent incidents of vandalism and looting across the city forced some of them to close down permanently, as the largely peaceful protests were infiltrated by those who used them as a cover to rob stores. And these shops were vandalized and set on fire. The firefighters had worked all night to contain the blazes. The nearby shop owners rushed the next morning to see what damage their businesses might have suffered.
I really was concerned, especially after getting here and seeing this. I'm like, wow, we're lucky because it's like right across the street.
Amelia is worried about losing more business at a time when she needs it more than ever.
I mean, I haven't had income since March. That's how badly I've been hurt. And it seems like this is just prolonging like everything because it's not going to go back to normal if people keep ransacking everything.
While she fully supports the cause, she's also worried about leaving her shop unattended. Among the most commonly targeted were stores selling jewelry and luxury goods, as well as pharmacies. In the aftermath, some locals struggled to get their prescription drugs on time.
I have a sufficient supply to last another week, maybe 2 weeks, but had I been running short, it would be a very major inconvenience.
Other business owners witnessing such lootings day after day had no other option but to resort to additional protections.
We've been struggling for the last 3 months. And we were ready to start making some money to recover, and now we couldn't afford the destruction anymore. I mean, if something happened, then that's it. We will close for good, forever.
That's a common sentiment among many business owners who follow the same strategy of putting up wooden boards on their storefronts, a measure that's now adding more uncertainty to the whole recovery process.
It has been a long time coming, but Twitter has now given U.S. President Donald Trump one of many sanctions to come. The social media company took down on Thursday over a copyright complaint Trump's video tribute to late George Floyd. 1 minute into the 4-minute video that was supposed to be a tribute, Trump was seen railing against activist group Antifa and other radical left-wing groups. Antifa stands for anti-fascist. Trump says these groups are terrorizing the innocent at the nationwide protest in the wake of Floyd's death. Twitter left up the post but removed the videos and placed an overlay on them. Twitter spokesperson Lauren Alexander says the action was taken because of a copyright complaint under the Digital Millennium Copyright Act. A third-party research firm that tracks copyright complaints, Lumen Database, says the notice originated from the law office of Sam Kulak in Burbank, California. The European Commission has called on all EU member countries to lift all internal border restrictions by the end of the month and allow passport-free travel across the bloc. Home Affairs Commissioner Gillo Johansson says it is good that EU members were already easing border controls before now. Countries are already phasing out domestic restrictions across Europe, and some have begun to reopen borders, but no date has been announced for reopening EU external borders. Parks are reopening in Europe and people are taking back the streets. Australia has announced plans to jumpstart tourism. Restrictions are easing in the United States as well, even though infections and death rates are still high. But while much of the world is negotiating terms for reopening, Brazilians are worried about the country's easing of lockdown restrictions. Correspondent Lucrecia Francio reports.
Sun and surf, a beach reopening. It's a postcard view, but densely populated Copacabana has become the city's deadliest coronavirus hotspot. 80-year-old Sergio Chagas, who caught and survived the coronavirus, counts himself among the lucky ones.
Copacabana is a neighborhood of older people. It has the highest percentage of elderly in all of Brazil, and these old people are not following social distancing recommendations at all. They act like it's a joke.
According to the latest census, 30% of Copacabana residents are 60 or over, putting them in the highest risk group for getting seriously ill or even dying from COVID-19. But people are starting to get desperate.
The thing is, they have to give us a bit of freedom. All these people who are stuck in their apartments for weeks, they are shouting through their buildings that they are locked up in jail. They want out.
This week, some restrictions were eased, allowing residents back into parks and onto beaches, as long as they maintain safe social distancing. But it is here in Copacabana, where most people should be following the stay-at-home rules, that the number of new coronavirus cases continues to rise. The neighborhood has reported more than 1,400 COVID-19 cases with a 10% fatality rate, the highest in both categories per capita in the city.
And the numbers keep going up.
Some residents, like Mary Galanternick, say they are staying inside until they know it is safe.
The thing that I'm most afraid of is that with this relaxing of the rules and with the OMS saying that Brazil has not reached the peak yet, that we will face, I don't know, a tragedy, a catastrophe, I don't know.
But if there is concern, one would never know it by looking at these sun-worshipping Brazilians.
Up next, sports. Premier League clubs agree to 5 substitutions rule change. Please stay with us.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News and Sport. The number of substitutions in the Premier League will be increased from 3 to 5 when matches return in 2 weeks. The 20-member clubs met on Thursday to discuss measures on how to achieve well-coordinated football matches. Shareholders also approved for clubs to increase the maximum number of substitute players on the bench from 7 to 9 for the rest of this season. FIFA proposed this substitution rule change to IFAB, which is responsible for the laws of the game. And it appears the rest of the NBA season will be played at Florida's Disney World Resort from the end of next month. The season was suspended in March because of COVID-19. 13 Western Conference teams and 9 Eastern Conference teams will contest 8 games each to determine seedings for the playoffs. Under the NBA's proposal, all 22 teams will be based at the resort and games will be played without spectators to minimize the spread of COVID-19. The plan has been approved by the NBA Board of Governors. That is in the news this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatuji. Have a safe weekend.